Good afternoon. My name is Pat Living. I'm with the Department of Health and Social Services, and I will be your moderator for the COVID-19 update for Monday, May 20th. We are joined today by the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Following Dr. Hanley's words, we will go to the phone lines and take media calls. We'll take one call and one follow-up, and if we have any time left, we'll go back to the phone lines. Thank you. Dr. Hanley?
Thank you. Good afternoon. Bonjour. For the first time in what seems like weeks, there was something other than COVID to take the headlines today. The horrific shootings and multiple fatalities in rural Nova Scotia. Since COVID-19's arrival in Canada, our belief in a secure and predictable world has already been shaken. With this recent shocking event, we are challenged even further in this belief. As Yukoners, we have close ties around the country, so that even from this distance, and even in a world that has gone virtual, we feel just as viscerally the shockwave of grief that all Canadians must share. Already stressed with COVID, it is normal to feel numb, angry, scared, or overcome with emotion as we read about these events, even if we did not know anyone involved. These are normal reactions to any incident that makes us question the Canada that we thought we knew. There's no one way to react or to feel when we're confronted with mass acts of violence such as this, but there are lots of things that we can do to help our mental health. This is a time to remind ourselves of the importance of simple acts such as being kind to ourselves and to others, getting outside for even 15 to 20 minutes per day, appreciating nature, ensuring we monitor our caffeine, alcohol, and drug intake, appreciating nature, staying connected with our families and friends, getting the sleep that we require, and remembering to eat well and stay hydrated. Our emotional stability is greatly supported by ensuring we have the basics of self-care as part of a regular routine. Reaching out for extra mental health support at this time is a sign of strength. Seeking mental health care early on is proactive health care, as important as going for a screening test or getting your vaccinations. A little repetition in French. Chacun d'entre nous a développé ses propres mécanismes de défense pour faire face à une telle situation de violence. Cela dit, il existe plusieurs moyens pour préserver notre santé mentale. Une routine comprenant des soins personnels de base favorise grandement la stabilité émotionnelle. Et dans les circonstances, n'oublions pas qu'appeler à l'aide est signe de grande force. Demander des soins en santé mentale dès qu'on se sent fragile est d'ailleurs un signe de prévoyance et est tout aussi important que de subir un test de dépistage et de recevoir des vaccins. If you need help, here are a few resources at the ready. You can call the Mental Wellness and Substance Use Services for phone counselling appointments for any reason right away. You can also call the Canadian Mental Health Association for counselling phone appointments. The phone numbers are available on the Yukon Health and Services Facebook page and also on the yukon.ca COVID-19 website. You can just Google Yukon COVID-19 counselling and you'll see many resources before you. And don't feel that you should keep these resources for others. They're here for all Yukoners, and they're looking forward to speaking with you. I do have some important case updates for today. This does involve new numbers, and over the next few days we may see additional associated cases. As of today, there are 2 new cases of COVID-19 in the territory, bringing the total number of cases to 11. The recent cases represent Yukon's second COVID cluster event. Thus, cases number 10 and 11 are directly related to the case number 9 investigation that was our new case from Friday. En date d'aujourd'hui, on compte 2 nouveaux cas de COVID-19 dans le territoire, ce qui porte le nombre total à 11. Ces 2 nouveaux cas, 10 et 11, sont liés à un 2e foyer de COVID-19 au Yukon. Ils ont été détectés dans le cadre de l'enquête menée en lien avec le 9e cas annoncé vendredi dernier. As there were symptomatic contacts within the affected households, we were expecting to see more positives associated with this family cluster. All are doing well. Most importantly, the family members were already observing self-isolation due to some family members having traveled internationally. Case investigation and contact tracing continue as we speak, and I will update you when we have further information or advice. For some good news, the first 8 people positive for COVID have now recovered, so the only cases at present are those associated with the current cluster. As I mentioned on Friday, these recent additions to our number of positives reinforce the need to observe all the measures that we have been rehearsing over the last few weeks. We are still less than a month from the detection of Yukon's first COVID case. Even as we remain confident in our strategy to date, COVID is still very much a daily reality in Yukon. On the other hand, even with these recent cases, and possibly more to come, we can confidently pursue and continue our pursuit of the goal to stay in containment mode and stay ahead of community spread in Yukon. To do so, in addition to all the public health activity, we must continue to maintain that society where it is difficult for COVID to spread. We all must continue to abide by the 6 principles of staying safe: physical distancing, regular hand washing, staying home and away from others when sick, limiting social gatherings, avoiding non-essential travel to communities, and self-isolating when required by orders. We need time to process as a country the still unfolding story in Nova Scotia, complicated in its tragic consequences by the new COVID reality that we live in. Even when we cannot gather together in vigil or in memorial, we can remember we're in this together. It's especially important to remember we're part of a community that relies on each other and that cares about each other. Faced with such additional challenges, whether new shocks or more cases, we remain in this together, and we can only get through this together. We can and will continue to heal as a community and to thrive in this brave new COVID world. Thank you.
Thank you, Dr. Hanley. We'll go to the phone lines now. Tim, CKRW.
Hi, Dr. Hanley. It said this new case, related to the 9th case, and it's from international travel. Are you saying from which country it's from, or can you just maybe expand, on the 2 new cases and the 9th case?
Yeah, I can tell you, again, we're careful about giving too much information that may not be entirely relevant and could lead to identification, but I can say that it's associated with international travel, not domestic travel. And sorry, Tim, was there another part to your question?
Well, just asking you to expand. I'll just go with my follow-up now on just another question I want. Just the recovered, you said 8 recovered. Can you go through again what exactly constitutes a recovered case? And they have to go through, from what I've recalled, from what you've said in the past, they get tested once and they have to be clear for 14 days. But can they be tested again? Should they have a second test to make sure that they're actually free and clear?
So the question is testing required to verify recovered status, if I can summarize what you were asking, Tim. And the question is, we no longer use that because it's been found not to be a reliable test for recovery. And the reason is that the test that we use is so sensitive that it actually detects dead or leftover molecular material that may be present, but means nothing about the transmission possibility of disease. So it's like dead leftover virus, and that can actually persist for several weeks. So that's just what's been found through the experience of other jurisdictions. When the initial the initial requirement or guideline was for a negative test to verify recovery. We no longer use that. So symptoms and a reliable 2-week period from symptom onset. So you have to get better, you have to be symptom-free, and you have to be at least 14 days, or I should say 14 days from the onset of the symptoms. And then we are very confident that that person is no longer infectious.
Okay. Marie, Roboreal.
Hi, I have a question regarding the social distancing. Je vais la poser en français si c'est correct.
Oui.
Est-ce qu'on peut imaginer que les campings pourraient réouvrir cet été? Où est-ce qu'on en est avec la situation pour les campings en ce moment?
Oui, la question c'est sur le camping et si ça serait permis. The question is about camping and whether that will be permitted for the summer. Donc, je pourrais dire peut-être que c'est tôt pour dire définitivement, mais au même temps, j'encourage la poursuite des activités dehors. Donc, par exemple, si on est en famille avec les membres de famille qu'on est normalement avec dans la maison, et si on observe distance des autres, ça ne va pas empêcher une famille de faire le camping. Le problème, si les parcs de camping sont ouverts ou fermés. Et à ce moment, ils sont fermés. Donc, s'il y a d'autres endroits qui sont permis et qui ne sont pas dans les camps des parcs, je veux dire, à mon avis, c'est bon de faire ça en suivant toutes les mesures nécessaires. Donc, est-ce que je répète peut-être en anglais? Just to repeat that in English, what I'm saying is that the question is about camping, and at the moment the territorial campgrounds are closed. So whether they reopen or not, I think is a decision I can't speak to today. We will look over the weeks to come on when it might be safe and what we can advise. However, a family unit who belongs to the same household can still go and if they're otherwise well, they're not symptomatic, they're not in self-isolation, they can pursue outdoor activities, including camping, as long as it's on land where they have permission to camp, even if that's not in a territorial campground.
As-tu une autre question, Marie?
Non, merci, c'est bon.
Okay. We'll move to Gabrielle at Whitehorse Star.
Hi, can you expand on whether the household affected isolated immediately after the 9th case returned from international travel?
So I can say self-isolation was actually, so it's a little complicated to say yes because the case was actually a contact of a traveler. But what I can say is that within the family, when the travelers returned from travel, they did immediately self-isolate. So we had very good adherence for self-isolation throughout the periods of the case and contacts.
Follow-up, Gabrielle?
And, related to that, are some locations considered for being at risk of exposure as part of the tracing of this cluster?
So what I can say so far is that the contact investigation is still going with some very careful, repetitive questions on where there may have been any breach, let's say, of self-isolation. So that's a part I can't tell you. I'm confident that we're going to be able to continue the containment in this case, but it still makes some days to sort out whether there are any flags for potential for potential public exposure where we might have to put out some precautionary messaging. So I will probably be able to confirm that at our next media briefing.
We'll move now to Jane at CBC.
Hi, my questions were along a similar line about cluster. Is this cluster, is there any risk of community transmission? You're continuing this contact investigation, but is there any risk of it spreading beyond this family?
So I don't feel at this point, based on what we know, that this would pose any risk for community spread or community transmission. Clusters sometimes in themselves, however, can be very complicated to follow and can take quite a few days, sometimes even weeks, to sort out in the entirety, because it's a matter of going from one case to contacts, following the contacts. If the contacts are symptomatic, to test them, then to go through their contacts. So we can get into cluster investigations that are actually that can be complicated. I think we'll know within the next couple of days how many complications we anticipate from this particular cluster and how complicated that might get. But at the same time, we're still very confident in that containment strategy, and that we will be able to, even if it takes longer than the first cluster, that we will be able to identify contacts and have them contained appropriately, and ultimately contain this cluster.
Follow up, Jane?
So there's a chance that people hadn't fully self-isolated and had made some contact. That's what the investigation is trying to find out.
Yeah, there is. Even though we are, I'm very pleased with what I've heard about the self-isolation that was followed by the family members. We're always looking for potential leaks, and that's really part of the cluster and case contact investigation. Is looking, are there any potential leaks, and do these pose any risk that we need to notify the public about? Similar to one of the previous cases when we had to do those precautionary public notices. And again, to go back to those were notices for Whitehorse that involved Bethany Church and a dental clinic. Many people showed up to be tested, and none of them were positive. So usually these public notices are just a precautionary, just in case of any spread. I can't say at this time whether we'll be needing to do that as part of this cluster investigation. But those are some of the aspects that we're looking at basically as we speak.
Okay. We'll move to Chris at CBC.
No questions today. Thank you.
Okay. Gord, Yukon News.
Did I understand you say earlier that the cases 9, 10, 11 came into contact with an international traveler? Is that the relation to international travel?
So this is all within a family, within a household. So the travel, the international travel, was within the same family, where there was contact with symptomatic returned travelers, and then transmission within that family setting. So just to be clear, this was not a contact with international travel outside of the household, and that's why we're calling this essentially a family or household cluster.
Follow up, Gord.
Nope.
We'll move to Claudiane, Radio-Canada.
Oui, peut-être juste répéter en français, là, je pense que la portion à savoir un nouveau foyer d'infection, s'il y a un risque là, pour le public, s'il y a un risque d'exposition dans le public général.
Oui. Juste pour appliquer, just to explain the same thing in French, juste pour expliquer la même chose en français, c'est que on est maintenant en quête de mener l'investigation, l'enquête sur sur le foyer des cas qui sont contenus dans une famille. Et donc, à ce moment, on n'a pas à trouver un risque pour le public, mais on est toujours en train d'examiner toutes les possibilités s'il y a un exposé significatif dehors des maisons, ou dehors de la famille. Donc, c'est toujours en train. Je peux prendre les nouvelles quand on a cette information. Mais à ce moment, on ne voit pas une nécessité de poser ou de mettre une notification comme on a fait avant pour un cas, un des cas plus tôt dans notre série de cas. Je pense que c'était le 3e cas. Mais c'est important pour dire pour le moment, et on ne voit pas un risque pour la transmission dans le public. Donc, si on fait une affiche, par exemple, comme on a fait la dernière fois, c'est d'être avec toute prudence en cas de... Mais ça signifie pas une transmission dans la communauté.
Une autre question, Claudiane?
Non, c'est bon, merci.
Okay. Do we have anyone else on the line that I've missed? Do any of our reporters online have another question?
Last week, Dr. Hanley, that the testing requirements may be expanded from just someone who's traveled internationally and showing some symptoms to a broader set of requirements. I was wondering if those requirements have been sorted out yet.
Almost. So I'll probably be able to bring you some further updates on that later on this week. So we are, as influenza season is decreasing, we're seeing, and also as the travel restrictions have become more in place, we're seeing fewer people come for testing, as I said last time, and that's a good thing. But we also want to make sure that we have all the signals out for detecting any further cases as we go, especially as we want to contemplate any relaxing of measures. We have to make sure that we are very vigilant as to any signal of cases that may be missed according to existing criteria. So it's really adjusting criteria as we go, according to the risk and according to the risk of importation and to other risks that we may want to be very attuned to. So an example of that would be the testing that we carry out in long-term care. Which already we can do testing, of course, in long-term care, if in continuing care, if we for any signal, but it's just adjusting those signals so that we have a very low threshold for testing in certain populations. We also already have a low threshold for testing in rural communities, but we're currently looking at revising our testing criteria. So I'll be able to bring you more details very soon on that by the end, if not the middle of this week.
Tim?
Hi, Dr. Hanley. Just follow-up clarification. According to the new numbers, there's 2 pending results. Are the 2 pending results related to this cases 9, 10, 11?
I can't tell you specifically because I don't follow, of course, every test. That may well be the case, and there may well be more case investigations or numbers relating to these in the days to come. So we certainly do have more testing underway or imminent as part of this cluster investigation.
I'd like to thank you for your questions today. The next update will be on Wednesday, April 22nd at 3 p.m. Thank you.